Hello, and welcome to Live Parkinson's, Live an Exceptional Life. I'm your host, Chris Custenbotter, and I've been living an exceptional life with Parkinson's for the past 14 years. The mission of this podcast is to help as many people as possible living with Parkinson's lead a great quality of life. Today's topic is building a Parkinson's care team, how exercise, speech therapy, and physical therapy transform lives. Are you ready to take control of your Parkinson's journey and elevate your quality of life? In this episode, we're bringing together a powerhouse team of experts, a certified personal trainer specializing in Parkinson's programs, a speech therapist, and a physical therapist to reveal how exercise, social interaction, and personalized care can transform your daily experience living with Parkinson's. Whether you're looking to strengthen your body, improve communication, or enhance your overall well-being, this conversation will provide you with the tools and insights to live your best life with Parkinson's. Don't miss this opportunity to learn how these key players fit into your Parkinson's care team and what they can do for you. Living with Parkinson's for almost 15 years, I've seen the importance of developing a Parkinson's care team. Over the course of my medical care, I've had the opportunity to work with and realize the benefits of working with a certified personal trainer specializing in Parkinson's, a speech therapist, and a physical therapist. Now, I'm fortunate to have three on this podcast to discuss their role in the Parkinson's care team and how they can help you have better outcomes on your Parkinson's journey. So, without further ado, let me introduce you to our guest panel today. Sitting on my right is Susanna Gillespie. She has a master's and is currently finishing her doctorate degree. She's the vice president of membership and recreation at the Jewish Federation of Greater Harrisburg, where she oversees the fitness program and is implementing a Parkinson's-focused program aptly named PUNCH, which stands for Parkinson's Unified Neuromuscular Conditioning and Health. And it's a holistic program designed to improve participants' and caregivers' quality of life. Next up is Gabriella Ron, MSCCC SLP. So in case you're wondering what CCC SLP stands for, it's a Certificate of Clinical Competency in Speech Language Pathology, which is a professional certification awarded by the American Speech Language Hearing Association to speech therapists who have met rigorous academic, clinical, and examination requirements. It signifies the therapist is highly qualified and has demonstrated competency in the field of speech language pathology. Now, I've been fortunate enough to work with these two lovely individuals, and they both helped me dramatically in my Parkinson's journey. And then finally, we have Mike, a physical therapist. He's been a physical therapist for 15 years, and he's worked across pretty much every type of patient care, acute care, outpatient care, and rehab. He actually went to the same university as my daughter, Indiana University of Pennsylvania, where he got his BS in exercise physiology. And he has a doctorate in physical therapy from Arcadia University just outside of Philadelphia. So welcome, everyone. So let's start out with mix it up a little bit today and try to blend in the questions so that we look like a care team. How's that sound? All right, so let's start with you, Susanna. What inspired you to specialize in working with Parkinson's patients?
I like to think that it's kind of like how Bob Ross said, it's a happy little accident. I had been working in personal training, and sometimes you just kind of get whoever walked in your door. And so I was working with a number of different, I had the opportunity to go out for training in Arizona and work with the Power Gym, which is Parkinson's Wellness Recovery. And from that, we really discovered that Pennsylvania had a hotspot of individuals with Parkinson's, and we saw a need and started developing a program. So that just really became a love with working with bringing the medical aspect of training together with a lot of people that were in our community. So we really was able to use a lot of different sides of our brain and our talents to really help the individuals that needed it most.
That's great. I wonder why there's such a concentration in Pennsylvania, but
the agriculture and the manufacturing chemicals are a big part of it.
Oh, pesticides and herbicides. Oh, great.
Yeah.
Gabrielle, had the opportunity to work with you on 2 different occasions, and you definitely helped me. So can you tell me what the role of a speech therapist does, how you can help a person with Parkinson's?
So it's a couple of different things. I think the classic thing we think about is that patients with Parkinson's might get a quieter voice and they're harder for people to understand them. So we definitely do exercises and therapy to work on that. The other piece that's significant may be that if the disease progresses, there's difficulty with swallowing. So we do rehab the swallowing muscles, evaluate that, treat that. And then sometimes there can be some cognitive changes, difficulty with memory, difficulty with finding your words, that type of thing. So we can do therapy for that as well.
Oh, okay, great. Yeah, it's definitely, I highly recommend a speech therapist as well. Mike, can you tell us a little bit about what physical therapy is and what the role the physical therapist plays in working with people with Parkinson's?
Well, physical therapy covers a lot of different patients that have Parkinson's disease. We focus mostly on trying to restore or maintain their ability to function and mobilize and do so safely, and also do our best to try to slow the progression of disease, falling, just try to keep them active and mobile for as long as possible.
Okay, great. That's a great overview on what each of you does. So let's talk a little bit about communication, because that seems to be one of the issues that everybody with Parkinson's has. Gabrielle, how do you deal with people that come in that have communication problems? Well, it doesn't necessarily have to be communication problems, but you also deal with people that have swallowing issues as well. So can you talk a little bit about how you can help both the person that might have communication and swallowing issues?
So we would start with an evaluation, obviously, kind of seeing how they're doing in terms of their communication. I think a caveat with Parkinson's is that it has a tendency to make the patient feel that they maybe aren't as impaired as they may be, kind of tricks the volume center of your brain. So it sort of dampens it. So what they feel is a normal speaking volume tends to not be technically adequate. So we have to kind of sell them on that a little bit. So we're going to work on evaluating what their volume level is, what their intelligibility is. So how understandable are they with familiar and unfamiliar listeners? And then in terms of the swallowing, we may do a clinical evaluation where we just give them some things to eat and drink, see how the swallow muscles are working. If we're not clear or we're not certain or we want to be even more definitive, we do swallow x-rays. So it's like a video of their swallow that we can watch the food and liquid go down, determine if there's any dysfunction, and then based on what that dysfunction is, we'll rehab it with therapeutic exercises, sometimes electrical stim, different things like that.
So, Susanna, you probably see people come in with communication issues, and a lot of times they start to develop some social anxiety or some social phobias because they're afraid that they can't communicate with others. Right. Since you're starting up a new program, the Punch program, can you talk a little bit about how you try to get people involved so they can interact socially and communicate better?
Absolutely. I think one of the biggest fears is, especially we have a number of people already in the classes. And when the individuals start, they look at that and say, hey, like I can't do those things and I'm not going to be part of the group. So one of the things I love to do is first bring them in, let them observe a class to see that there's a variety of abilities, there's a variety of individuals, ages. Everybody is coming in at their own ability, and the instructor is ready and available to adjust the class to meet the individual's needs. Then I will bring people in, do an assessment as well, find out where they are. So also as an instructor, I can tailor different skills within the class to meet each person's need. And then depending on where they are and if they're apprehensive enough, I'll also offer personal training right from the beginning to make sure that they can develop that relationship with me as the instructor. So once we have that kind of camaraderie and that friendship, then we translate that into class. So they're already feeling good about some of their skills, about being in a new place, in a new environment. And that way it really translates really nicely into class and then a social setting.
Oh, great. Mike, let's transition a little bit to talking about movement issues, because that's one of the big things that people with Parkinson's face on a daily basis. We have problems with either balance and gait or tremors. So can you tell a little bit about how you might assess someone when they first come into to see you for physical therapy?
So a lot of times, strength isn't necessarily a big problem with patients with Parkinson's disease. It's more their ability to produce movements, and I basically, say it to them: get your body to do what your mind is telling it to. There tends to be a delay, which can put them at risk for falls, delay in balance and responding to loss of balance, and then also just putting together movements, multiple joints, and being able to process something that's a little bit more complex than just a small movement. So, we look at a variety of different movements with them. We have different tests, different standardized tests that we can do where we time how long it takes them to do certain things, the response time, and then we kind of put together all of that information and come up with an overall game plan of care of what we can do to help out.
Great. And then you give homework assignments then so they're supposed to go home and do the exercises. Would you say you get pretty good compliance with that?
With the Parkinson's patients, typically, yes. They understand the importance of activity and mobility and carry over outside of therapy. So I always just try to tell them you're going to get out of it what you put into it. So the more you do, the more resources you have, other exercise programs outside of therapy, go ahead and do all.
Great. Now, since we're talking about a care team, how would you transition what you do to something like with what Susanna does, so that you've given them the skills and the exercises, but then to get them to go to a fitness center or participate in a Parkinson's program, how would you maybe work with someone like Susanna to transition a patient like that?
Well, I'll be honest, the communication from therapy to outside exercise isn't the best. We could definitely do better with doing that, having better carryover. I usually try to make sure that the patient knows where their strengths are, where their areas of improvement are, where certain things that would put them at a risk for a fall would be, and say that, okay, kind of avoid doing these things, focus on these other areas, and then kind of go from there. It's best if they can get started with another exercise program before finishing therapy. That way they can bring back to me what they're doing there and kind of.
Great. Okay, Susanna, so they've come from physical therapy, and your job is to try to get them to come in on a consistent basis, because if you look at all the science and the data, it's consistency is key, because you're not going to get the benefit if you don't do it. So what are some suggestions that you would have for someone that comes in with either as a patient and or the caregiver to try to help get that person into a consistent program?
Sure. One thing I'd like to ask is if you have papers that your physical therapist or occupational therapist has provided you on discharge, bring them into us so we can see what you were working on and what we can do to translate that into class or the fitness center environment. A lot of people will see something and take it very literally and say, like, well, I don't see this machine or this piece of equipment right in my fitness center, so I can't do it here. And I'm like, well, we might have not the exact same brand, but I can show you how to make it work for us. And I think once they get over that fear, that stress moment where it doesn't look the exact same, but they realize it really is the same movement, that reduces some of the anxiety about that. And I think just having the communication between the different parties, one of the things we tend to work on is developing relationships with the different practices and really reaching out. So we do have a referral system. And also we'll talk to the individuals that are coming into the program and say, hey, we're also very happy to give paperwork for you to take back to your care team to give you information like our tug tests, our walk backwards tests, standing on one foot, balance sweats. So they can also have ongoing feedback on what you're progressing, so they know that I'm keeping my eye on you, so also your care team can keep a better eye on you, so it's a little bit more accountability as well.
So can you have a buddy system as well, where you have another person in the class with Parkinson's that you might hook them up with?
Oh, that for sure. Yeah.
Because I know that seems to help if you have a friend that, that'll help you along. Mm-hmm. Okay, Gabrielle, you have people with Parkinson's, and they've got this, anxiety and depression is a big thing. And a lot of times people hear the word therapist and, they panic and think, I don't want to, the stigma of going to seeing a therapist. So what are some of the suggestions that you would have either for the person with Parkinson's or the caregiver to get them over the hurdle of coming to see you? And at what point should the Parkinson's patient say, hey, I need some intervention because I'm having trouble communicating with people?
I think that it's really about forming a nice relationship with the patient and finding some kind of common ground that you can just share with them and have them motivated to come. So certainly, like I said, I do get, today I had an evaluation and the patient, typical, said, I don't think I'm not talking loud enough. I think my spouse has a hearing problem. That's my classic Parkinson's patient line. So I said, well, that's not the first time I've heard that. And let's talk about what they're hearing or what they're saying. And then when you dig a little deeper, well, do you find that you're having to repeat yourself to strangers or in a restaurant or here? And then when you kind of just shed that very gently, and then I always say the great thing about Parkinson's is that you can stave off the disease progression with exercise. That's so easy. And what I'm going to give you is exercise. And you're going to do it every day. And if you do it all the time and you do it the way you're supposed to, you will get benefits. So it's easy. The voice exercises are easy. And then usually that can get them to have some buy-in. And I also use a lot of biofeedback. So I will do conversational tasks or structured tasks, and I make them listen to it back being recorded. And then sometimes they'll have those aha moments of, oh yeah, boy, I don't sound very good. I thought I sounded better than that. So that's really nice too, to just give them some insight.
Yeah, I mean, I agree with everything you said. As being one of your patients, that I know when I first went, it was, well, I don't think I'm, talking softly, but my wife would say, I can't hear you. Or, my neighbor, he's 84, and I would always say, well, it's just because he's 84. But then I'd go to a restaurant, my brother's, you need to speak up.
Exactly.
And so when I first went, you gave me the exercises to do, but I think what really hit home is when you recorded it and then played it back, it's like, oh yeah, I guess I do need to work on this. And if you work on the exercises, you're going to get the results.
Exactly.
So
Exactly.
I think that's important. So I guess one of the things with a care team is, where do you get the referrals? Do patients have to request from their doctor to come see you? Or do you typically find physicians, whether it's speech therapy or physical therapy, where their physicians just say, based on my evaluation, I need to send you to see either speech or physical therapy?
It can come from a variety of ways. It can be your family doctor. So it's very common if you have Parkinson's and you or your spouse says he's choking when he eats or he's coughing all the time when he swallows. That's going to trigger an immediate response, and the PCP will typically just refer. Same thing with voice if they complain. Neurology is a big referral source, though, and I will say, and speak for Mike too, that we kind of work as a team with PTOT and speech. So even when I get a speech referral, if they haven't had PT and I think they need PT, I'll say, do you think you could benefit from this? And if so, would you be interested? I'll message the doctor. Sometimes I'll have the PT or the OT come in and just talk to the patient briefly, do a couple little quick things just to kind of screen them, and then say, do you think they'd be appropriate for a referral? And then get them in the door that way. But certainly the patient can always ask. And I always say after I discharge, because Parkinson's is progressive, this doesn't mean this is the end of the road for you. If you want to come back and get a tune-up in 2 years, or you feel like you need to practice some things some more, the door is always open.
Yeah, that was going to be my question, is because I know I've gone at least twice. Mike, now in terms of physical therapy, you have a patient maybe that comes in to you the first time and they have balance issues. And then can they come back later on for something different? Like, hey, I have trouble with my gait, and I'm having trouble with freezing and walking. So it doesn't always have to, you don't always have to see them for the same type of motor symptom. Is that correct?
Yeah, pretty much. And that goes for any, it doesn't really matter what you're coming for. If there's some movement dysfunction or disorder, we can always help them maintain their level of functioning and quality of life as long as possible.
Great. Suzanne, I've read some studies. I did a couple podcasts on exercise, and one of the things that I came across from the Parkinson's Foundation is that those people that start exercising early have slower progression of the disease than those people that start later. So how do you suggest people get early intervention after they've been diagnosed? And then how can you help them develop a plan to stay consistent?
Yeah. I think the biggest thing is for the physicians and the neurologists to be educating their participants. So educating the neurologist to educate their patients is number one. I've even seen in the last 5 years such a big difference between what we initially saw, which was the doctors kind of saying, it might help, to now everyone that's coming in, my doctor recommended this to me. So for me, that brings me such joy to see that tide has changed. So having the doctor buy-in is a huge boost to giving what we're doing credit and to really helping them to attach themselves to the program and to the process from the very beginning. And I think what I always tell people, you're not going to see results after doing it once. Just like you can't eat one piece of broccoli and see a change in your blood work. So you have to keep consistent with. I said, I'm going to see changes in you before you're going to see changes probably in you, and that's probably going to take a couple of months. So you're really going to have to give this 2-3 times a week for a couple of months for you to really have that aha moment and say like, oh my gosh, this is working. And I said, once you see that happen, it's really easy to keep coming and going. But I said, for those first couple of months, you just have to trust me and know that we know this is going to work for you. And then it's so much easier to keep going with it.
Yeah. And the other thing that, when you look at the literature, it's pick things that that you like to do or that that you want to do on a daily basis. So a lot of people think, well, I got to go out there and run or cycle. Just put sneakers on and go out and go for a walk. Or, strength training. A lot of people think, oh, I can't go to the gym because those people are lifting those big weights and dropping those big weights, and I can't do that. And it's you don't have to lift heavy weights. You can lift light weights and do a lot of repetitions or do more repetitions and get the same benefit. But, I think that if you look at a lot of the data, that you try to want to include a lot of different types of, cardio, the strength and flexibility, balance, and those type of things. And group fitness classes are a good way to do that and meet people. So I guess as part of the team, what are some of the biggest challenges each of you see when you have someone with Parkinson's coming to you? Do you see consistency across, let's put it that way. So what are some of the common themes that you see or common challenges that you would have that most Parkinson's patients come to you with? Because I'm sure you probably see similar challenges and then you can go, oh, I've seen this before. So here's how I deal with it.
My first two are really, I don't need to get started yet because I'm not that bad. And they want to wait until things get worse. And I always say, start right now and it's only going to get better. And my second is their doctor will recommend one thing because, they hear Rock City Boxing and we think immediately they could only do that. And that's one of the big reasons why we developed our program to be encompassing boxing and cycling and flexibility and strength training, because they need all of it. And once we incorporated all those extra modalities, we've seen such a big change, especially with the flexibility component. That's been a game changer for us. Their bodies have just opened up, their posture has improved so much more, their balance has improved so much more because we've made their fitness plan so much different than what it started out with being, and the cognitive challenges as well.
I would say probably something we hear a lot is, how are you going to fix this? Like, I can't see it, so it's not tangible. I think physical exercise is very tangible for people. They can see it, they get it. But if we're doing cognitive challenges or word finding things, they don't quite understand how that's going to translate or how I can do exercises to help that. And then when they get better, then they buy into it. I think probably the other challenge is what I said before, that very often if the patient doesn't think their voice is an issue or think that their speech is a problem, then it's getting the buy-in to them to have that aha moment of, okay, you're right, this isn't quite as clear as I thought it was, and maybe I should do something about it.
Yeah. Now, do you have people that expect you to fix the problem and don't want to have any ownership at all?
For the most part with this population, no. That's why I love to work with Parkinson's, because most of the time they are so motivated and they're so excited with any little change, and they're so appreciative, and they work really, really hard.
Okay, great.
Yeah.
So most of the patients I've seen with Parkinson's have done really well. I'd say the only challenges I've really faced are as the disease progresses and their body's shutting down, a lot of frustration sets in. And, someone who used to be very active and mobile, now really struggling, shuffling their feet a lot, having poor balance, and just feeling like they want to give up. So we have to kind of take a look and figure out how to motivate them, how to reel them back in, and, like Gabrielle said, buy into the program and, get to work on it and not let them pull themselves out.
Great. All right. Just to kind of wrap up here, can you give me one success story of someone that you've worked with that came out and had really good results?
I was going to say, I probably would say my patients that started, and I can play back like when they started with what speech tasks we did, and they sound, quiet, they're mumbling, it's very hard to understand. And then by the end of therapy, They are talking louder, it's more intelligible. Oftentimes their facial expressions really improve, which is another really great thing with, there's some standardized voice programs out there, and the one that I do, it literally can change how their facial muscles move. And that's really exciting because, it's very challenging. I mean, I've had patients say to me, I'm so excited right now, but when you look at their face, they look so flat and their face doesn't match what they're saying. So when you get them more looking like themselves and they say that people understand them and they can communicate better and they're kind of engaging again, that's reward right there. So they can do that.
Great.
I would say stories that I can remember. The best ones are when someone reports back to me that friends or family members have noticed improved posture, standing up straighter, walking better, not looking like they're shuffling, not looking like they have Parkinson's disease, or even being able to progress from a walker to a cane to not using any device at all. Those are the best ones.
I think it's, for me, a style where people come in and not believe that they can make changes, and they really kind of come in with their mindset that they're going to fail. And they're like one toe in and 10 toes out. And all of a sudden, they kind of keep showing up and keep showing up and keep showing up. And then all of a sudden, you see that change and their sparkle comes back. And when that sparkle comes and they find the joy in the exercise and the joy in the social aspect of it, the joy in just moving their body, and it makes everything just come together, because once they love doing it, all of the results will come.
Okay, great. And I guess one final question is, in terms of the Parkinson's care team, how do you see your role fitting in? I mean, is it something that you feel is absolutely necessary, or it's kind of ancillary and nice to have? But how would you, if you had a caregiver, and, because sometimes the person with Parkinson's may not want to have a Parkinson's support team. So how would you talk to either the caregiver or the person with Parkinson's to get them to understand that the importance of working across different modalities to get the best results, I guess, is my question, if that makes sense.
I'm a big proponent. I always say forewarned is forearmed. So I like to tell everybody, here's all of the things that could happen. I'm not saying that to be a wet blanket, but I just think you need to know that from my perspective, you could have changes in your swallowing. Right now you don't. That's fantastic. You could have changes in your thinking or your word finding or your communication. And just know that there are resources out there, and don't wait until it gets to the point where it's very impaired. You do it, get intervention as soon as possible and just try it and see if it helps. Because any way that you can continue to stave off anything that could possibly happen is going to be beneficial. I think the exercise with PT and any exercise classes, though, that is definitely a huge, component to this as well.
I would say with the physical therapy, it's more short-term, working with them, trying to restore their function, essentially rehabilitate them, get them to a point where they can continue exercising independently or with another class. And similar to what Gabrielle said, is trying to let the patients know, here's what you're working with right now, but here's some other possible things that could potentially come up in the future. And if they do, here's what we do about it, and you can come on back and take another look at it. But really just educate them on the importance of continued exercise and activity.
I think on our level, because we see people for a long time and have a long-term relationship, we see a lot of the subtle changes. And I think one of my biggest joys is being able to empower the participants and kind of tell them, I'm like, you're the boss and you have to ask for what you need. And if we're seeing those changes and I'm saying, like, this is different for you. I know you, I've been with you for years and years. This is different and you need to ask for something. So being able to help direct them to some of the resources that they might not know are available to them is really good, because some people just don't know what's out there. And especially if their doctor is not advocating for them, to being able to be that person that says, hey, there is speech therapy, there is PT, there is OT that's available to you. You just need to ask for it. And that's a great way to be able to be that resource to point them into the resources that they need.
Great, thanks. Yeah, I always talk about, and the name of the podcast is Live an Exceptional Life. And the reason I say that, and it's subjective, everybody, what's exceptional to me might not be exceptional to someone else. But what I try to convey to people, and that's one of the reasons I wanted to do the podcast, is to help people understand that there are daily challenges, and I'm not trying to sugarcoat it, because there's days I wake up and you think, what bus just hit me, and your balance is off, or whatever the challenge is, but there's always ways to get around the challenge and be positive and optimistic and start early and stay socially connected. And one of the ways you can do that is by working with a team, with exercise, speech therapy, and physical therapy, because everybody's there to help. And it's take advantage of the resources that are out there. And by doing that, you're going to have a better quality of life, and your family's going to have a better quality of life. So I guess if I could leave with one thing, it would be to take advantage of the resources and the people that have the knowledge and experience, like the three of you, and you're going to end up living a great quality of life and not letting Parkinson's get in your way. Learn new things, try new hobbies, try new things, but just try to take advantage of the care team, because they really are going to help you out. So, I wanted to thank all of you for participating today. I really appreciate your input, and I hope going forward that people will start utilizing some of the services that you can provide and some of the experience that you can share with them. So thanks again. As we conclude this episode on building a Parkinson's care team, I again want to thank Susanna, Gabrielle, and Mike for their sharing their experiences and input. They did a great job. Now, before we close, I'd like to please request that you visit liveparkinsons.com and sign up for the free monthly newsletter. And you also receive the document that has 9 balance exercises to help you improve your balance with Parkinson's. And then also, I have a link to my Ko-fi page. So if you feel like that the information that I provide is valuable and you want to support the channel, then please visit my Ko-fi page. And then also, please visit my YouTube page and my new TikTok page for additional resources and videos to help you live a great quality of life. Again, I want to thank you for listening to this program, and I hope to see you in the future, and have a spectacular day. Thanks again.